The popping noise that you hear when you go to the chiropractor, when you are manipulated or when you are adjusted, that is the release of nitrogen gas. Nitrogen gas forms within the joint space. The joints are held together with a vacuum seal. When you move the joint, that gas is released. It actually creates what you call a cavitation, which is that gaseous release, and that makes a pop. Some patients have a little louder audible pop than others, and that has to do with the level of degeneration that you're talking about with the joint space itself. When the joints become arthritic, they become rough, and as those surfaces are rough, a lot of that gas is released in that there's not a real good vacuum seal on that joint anymore. You're getting some of that nitrogen gas leaking out. So you still get the move that you want with the joint. You take the pressure off of the nervous tissue and thereby create a healthier functioning joint, but you don't always get that cavitation person to person or patient to patient.